Welcome to Health, Hygiene and Wellness. Once again, my name is BARASA SAENYI Nicholas. This is a program that always keeps you on toes on matters health and your wellness. Today in the program, we are privileged once again to have Dr. Silas. He's here. We are going to discuss about breast cancer. So stay tuned. By the end of this program, I hope you'll get informed and also remind yourself of the things that you know about this disease.
At a very extensive rate. Then secondly, the reason why it is becoming expensive to treat cancer is because our people come to us when it's too late. So when you come to a doctor when it's too late, when the cancer has been invasive, for example, if you have a cancer of the brain, a tumor of the brain that has moved to all the parts of the brain, maybe the bones, it is difficult for a doctor to treat, or it's expensive for a doctor to treat that cancer. So that's why we encourage everybody to screen for cancer and come to us early. So that is where the late diagnosis is the elephant in the house. It's the one that is making cancer to be very expensive to treat. Yeah.
And now that makes it more expensive and even hard to find the treatment.
Yeah, true.
When we talk about breast cancer, we understand that it is the cancer that affects the breasts.
Yes.
I would say breast or brain.
Yes, breast.
Breast cancer affects the breast.
Yeah.
What are the other things that we know about it? How does it display itself?
You know, it's good to understand that both a man and a woman have breasts. So, you know, people usually think that only women have breasts. Even men have breasts. There are risk of breast cancer. In our county, even in the country, we have quite a good number of patients who are living with breast cancer, and they are men. So it is possible that a man will get breast cancer just like a woman. The only advantage that a man has to a woman towards breast cancer is the hormones, because the hormones in a man are different from the hormones in a woman. Even though the same hormones that a woman has, a man has, and the same hormones that a man has, a woman has, only that the ones for a man are suppressed in a woman in one way or another, and the ones in a woman are maybe suppressed in a man in one way or another. So that's why women are at risk of breast cancer, because, and we'll see as we discuss the importance of hormones in breast cancer and the risk factors. So the breast is a part of the skin. It's an organ that is part of the skin.
Can we say it's an extension of the skin?
Of the skin, exactly. Only that it has a lot of fat layer, nerves and everything, and also it's a sexual organ, so it's connected to the sexual system of a woman. So that's how different it is maybe from a man, but it's almost the same. So when you get cancer, what happens? These cells overgrow. So these cells become cancerous, like they become malignant. You know, you have two types of cell growth. There is benign cell growth and malignant cell growth. Benign is where the cells are overgrowing, for example, a breast lump, but it's not cancerous. But when you say it's cancerous, that lump that is in your breast has become cancerous. So that's why we encourage women, whenever they see a growth or a breast lump, just any, we call it tunaitanga mawe. Ukiona mawe kwa matiti, it's good for you to come and check it. Is it cancer or it's not cancer? Yeah, so those are the things that we need to look at when we are looking at the breast.
So it's possible that one can have the lump, but it's not cancerous.
Yeah, true. One can have a lump, one can have a breast swelling, but it's not cancerous. So when it becomes cancerous, or when it stays, the lump stays in the breast for so long, it can become cancerous. I know there are women who work with lumps for even 10 years. So after 10 years, maybe it can become cancerous. Yeah.
So in order to just clear up the panic, maybe I have a lump and you want to get it clear that maybe it's cancerous or it's not, you have to visit.
Just visit the doctor.
Yes.
You know, people always think, you know, there's a lot of theory. I don't know why people like reading a lot of things on Google. There are other people who just listen to other people who are not doctors. They just listen to these laymen and they want to follow their instruction that when you go to the hospital, they'll cut off your breast. You know, if that breast is cut off, the cancer will spread. it is not cancer yet. It's just a breast lump.
Yes.
Why don't you come to us? We confirm or we check. If you find it's a breast lump that is likely to move to cancer, then what we'll do, we'll just excise it, leave your breast alone, continue with your life. And there are several people who have done breast operations and they are still young. They have gone through that surgery and they are able to give birth and even breastfeed. So there's this theory that you hear outside saying that you can't breastfeed, you can't do what. All of it is not true, because when you have a breast lump, it can be removed, they throw it away, and your breast remains okay, functioning like it used to do later before, and you continue with your life. Yeah.
All right. Now, while reading about and researching about breast cancer, I realized that there is no cause for breast cancer.
Yes.
There is no exact cause for breast cancer. Then how does it come to exist, Doctor?
Then true, because most cancers have no cause. Most cancers, in fact, almost 80% have no cause. It's just, you know, what we have in our body, God created a programmed cell death. But when you develop cancer, that programmed cell death, which we call apoptosis, is affected in a way that it's no longer there. So the cells keep on growing without dying. So that is what we call cancer. So it's sometimes it can be because of genetics. If you have a family member who has breast cancer, you have the possibility of developing cancer. There are those cancer risk factors that we can even screen before. Even somebody who is 19 years, 20 years can be able to know if they can develop breast cancer when they get old. Because you understand, breast cancer is more common in people who are above 50 years.
Yes, yes.
Those who are less than 50 years, okay, it's there, but it's rare.
Not prone to it.
Yeah, but those who are above postmenopausal women, when those hormones start shading off, that's when you have a risk of developing breast cancer. And again, it's also your lifestyle. There is this obesity. Nowadays, we were looking at a certain, even this Kenya Demographic Health Survey that we did recently. The number of women who are obese in this country is very high. Almost 30% of the adult population are obese. You can imagine. And you know, obesity is a very great risk factor for cancer. So those things, and we have women who are taking alcohol, we have even people who are smoking. So those are the risk factors. People are no longer doing exercises. So those are the risk factors that we have. So they are just risk factors, but there's no specific cause to say that this is what caused the cancer. But obviously, there are risk factors. Yeah.
You've talked about the Kenya Demographic Health Survey and about it. If I may ask, what are the statistics about breast cancer right now in the country?
Currently, in the world, they are saying one out of 8 women are at risk of breast cancer. You can see, 1 out of 8 women, they are at risk of breast cancer. But currently in our country, breast cancer is one of the leading causes of mortality in women in Kenya. Followed closely by, cervical cancer comes first, then breast cancer. Yeah, because cervical cancer has been the leading cause of cancer death in women, then breast cancer follows. So almost 4% of our population of women above 50 years are at risk of breast cancer. That's what I can say in our country. Although those figures are almost going to project as the country moves into industrialization and other factors come in. The numbers are projecting. They are even skyrocketing because if you compare the data that we had last year and the data that we have this year, it's a bit different. Although what I can say is that the focus on breast cancer again has started lately, because in the previous years, like it's only the last 10 years that we have focused on cancer seriously. But the previous years, people are just dying of cancer. There were no registers. There are no screening registers to know if people are turning positive for breast cancer. But cancer was there. Yeah.
When let's talk about the risk factors for breast cancer. Is not breastfeeding your child one of the risk factors?
I know it's a very political question. That's a very political question.
Yes.
That is, there are so many people who talk about it out there.
Yes.
That if a woman does not breastfeed either the child or
Yes.
someone else, I don't want to mention that person, but if you don't do that, you'll get breast cancer. You know, that's not true. Yes, but in one way or another, if you look at the risk factors, a woman who has never breastfed a child, for example, a woman who is, let's say, infertile, has never given birth to a child, has a higher risk of getting breast cancer compared to a woman who has given birth to a child. A woman who has not been breastfeeding has a higher risk of cancer compared to a woman who has been breastfeeding. But that does not say that if you have never breastfed a child or if you have never given birth to a child, you will definitely get cancer. No, that's not true. But yes, it's true if you don't breastfeed a child or if you don't give birth, so which means you won't breastfeed, that means there is a possibility for you to get the breast cancer. But that's just a very trivial, a very small risk factor that does not make a woman to panic if they have never breastfed or maybe if they are not breastfeeding. Number two, risk factor is family planning. You know, there is a family planning that suppresses your menstrual cycle completely.
It alters your
Yeah, it alters your hormones. So also when you are choosing your family planning, you need to be very careful. Get a specialized nurse to advise you. I won't say it on TV that this is a very appropriate family planning method because you have to visit an expert. It's usually individualized.
Yes.
So I know people will ask themselves, why did the doctor not tell us about the best family? There's no best family planning. Each person has their own individual family planning method. But they have a risk, especially the hormonal. There are women when they are getting menopausal, you know, there are those symptoms, hot flashes, kutoka na jasho kila wakati and everything. So they decide to go to a doctor just to make sure so that the doctor can sort out their problem with menopause. So the doctor decides to give what we call hormone replacement therapy. So the hormone replacement therapies are not good. So if you are given a hormone replacement therapy by your doctor, just know that there is a high risk that you might get breast cancer because those hormone replacement therapies are not, they are a high risk for cancer. Although we do give as doctors, but we always warn the patients that they might give you a risk for cancer. So if you are on hormone replacement therapies currently, get to a doctor. Of course, we have the cardinal risk factors for cancer, which I've already mentioned: obesity, lack of exercise, especially people who work in offices. Somebody drives to the office in the morning, back to his house in a car. They don't do any exercise. At the end of it all, if you live that kind of life, for example, you got your job at 30 years, you work up to 60 years. Unfortunately, at 65 years, you might develop breast cancer because there is a risk for you didn't do any exercise. That is what we call sedentary lifestyle. Again, another risk is smoking, alcoholism, obesity. We have these other comorbid diseases like dyslipidemia, a lot of cholesterol in our body. Those are just risk factors for breast cancer. Then
I'm having one
Yeah.
that having a close member who had breast cancer at an early age. Is it also a risk factor?
Yes, I was coming to that. Genetics. We have, if your aunt or your close relative, especially a blood relative, had breast cancer, there is a risk that you will get breast cancer. There is a high risk, but it does not mean that you will get it. But you are the right person to be coming for screenings yearly because you had somebody in your family who had breast cancer. Number two, if one of your breasts had breast cancer, there is a risk for the other one. So don't just finish up with this one, clear it off, maybe they remove it, then you say you are now safe from cancer. No, the same risks for this breast are the same risks for this breast. So you need to be coming for regular screening. Then old age, of course. When you are above 50 years, there is a high risk for breast cancer because you are entering into menopause.
Yes.
So whatever you went through as a woman when you are still young can manifest as breast cancer. So that's why there is a high chance that people who are living above 50 years might get breast cancer. And that's why we are having this, there is an X-ray called a mammogram. That X-ray is very important. And we thank God, currently, if you have NHIF, you are able to use NHIF to screen. So it's just you to take your parent to the hospital, your mother who doesn't know about a mammogram,
Yes.
who is 50 years and above, for screening. And you do it after every 3 years. Very simple. You just take your mother to the hospital, they are above 50 years, you do the mammogram, they tell you it's normal. Another 3 years, you go back, it's normal.
That's how you keep them safe.
Yeah, but those who are young, you can do ultrasounds. Ultrasounds are cheap. They are not very expensive like mammograms, and they can be done anywhere, in any hospital.
Daktari, maybe we can talk about, we've forgotten about it. Okay, signs and symptoms about breast cancer. Is it only the lumps or there is other displays that come up with it?
Breast cancer is funny, and but as I was coming to TV today, I was really wondering now, why do people get breast cancer to an extent that they come to us in stage 4? You know, I was wondering, I didn't get an answer. Because if there is an organ that a woman sees every day is the breast, and if not just the woman, maybe the partner can be able to have a look at it and understand that the breast is sick or not sick. Because it's an organ that you can even check yourself every day.
Yes.
Because I know the way women dress, they always apply oil all over their body and everything. And they are able to even just examine themselves before the mirror and know that this breast is not normal.
Yes.
So I was wondering, why do people come to us in stage 4? It is because people are just ignorant. We could not be losing women because of breast cancer. Because if you are able to see that this breast, of course, I know the breast size is always not the same. Sometimes one of the breasts might be bigger than the other. But why don't you ask yourself, today this other breast is now bigger than the other? That's a question. Or maybe you look at the shape of your nipples and everything, they are not normal like they used to be. I know they keep on changing depending on the specific stage of life. Like if you are menstruating, if you are ovulating, if you are breastfeeding, the nipples won't be the same. But as a woman, you will know when you are going to menstruate, these nipples will be this shape and size. So you have to look at that. Then also the color of the breast. The breasts usually assume the skin color.
Yes.
But if you realize that your breast is turning more
Darker.
orange or more darker, why don't you come to a doctor? Because that is not normal. So most of the time as I was thinking about it, mostly it is about ignorance. Although I know there are people who don't have mirrors, or they have just that small mirror.
But if they don't have the mirrors, they can feel it.
Yeah, they can still feel it.
The lumps, yes.
Yeah, they can still feel the lumps. And if you feel any lump or if you feel any abnormality, very simple. You don't need to go to a very big hospital, a dispensary at home. That nurse is super trained than even the doctor that you think is well trained, the gynecologist in a big hospital. But nurses are super trained in examining the breasts than any other person, than even us doctors and even clinical officers and even other people.
They do their duty excellently.
They do it excellently. So the symptoms are not very obvious in the first stages. The breast, they can be a lump, they can be changed in breast color, they can be changed in the shape of the nipples. The nipples might be retracted, they might start discharging, the nipples might start getting blood, like if you are not breastfeeding but there's just something oozing from your nipple. That could be breast cancer. Of course, what you expect to ooze from the nipple always is milk.
Yes, milk.
If not milk, there is just some little watery fluid
yes.
that can come out when somebody is ovulating or when somebody is menstruating. Some women have that. Then another thing now, when you have cancer, the breast will become very painful. So when the breast becomes very painful, that is the bad thing about cancer. unfortunately, it could be stage 3 or 4. That's when it brings pain. But the other stages, no pain. Stage 1, stage 2, mostly no pain.
So it means once you start feeling the pain,
It is
it's all
advancing.
grown up.
Yeah, but don't fear to come. The other symptom could be a wound, a very open wound. You know, there are people who do, I don't know how to call it. It could be witchcraft, because you have a wound and you are not thinking about
you're still
breast
hiding.
cancer. You are just hiding it because of the smell and everything. So a woman just dies in the house with a very bad wound just because they think wamerogwa, ama another person saw them with a very bad eye and the breast ikafanya nini ikalipuka. So those things, you know, we hear those stories when you are in the hospital and they are very saddening.
All those are myths.
Yeah, they are myths. Just come to the hospital. If the breast has a wound, come to us. It could not be cancer, it could be an abscess, because also the breast can develop an abscess, especially when you are breastfeeding. There is a disease called mastitis that causes wounds. So if you have a wound, not necessarily that it is cancer, but why don't you go to a doctor
And
to just find out that it
Yes.
is breast cancer? Yeah.
Now, Daktari, when you have breast cancer, I understand that it affects the breast only. But how does it affect the rest of the body?
There is a process of metastasis of cancer called metastasis. So if breast goes through, if you have a breast cancer, it might move to the nearest organs, just like any other cancer. It moves either through the blood, especially through the lymph nodes, and sometimes it might just be invasive through the cells themselves. So if somebody has breast cancer, there's a likelihood this thing might move to the lungs, to the bones, to the lymph nodes near the axilla. That's why we always advise people to come to hospital, because even you, when you examine yourself at home, you might not know if there is cancer, because we usually look at the lymph nodes in the axillary region.
Yes.
If in your armpits, if your armpits have some small lymph nodes, even if you don't have a breast lump here, we raise a red flag, because it could be there is a cancer cell growing inside here that you have not felt. You know, cancer is not all about
grown.
lumps. Yes. People think that when you have breast cancer, you must have a lump. No. Sometimes you might develop breast cancer even without a lump. In fact, most lumps by day, they are not breast cancer. They are benign growths that can be removed and thrown away. And some women can just have normal lumps and the lumps go off. So sometimes when you visit a doctor, if they pick a lymph node in your armpit, it could be a sign that there is cancer cells growing in your breast. And your breasts are very normal, but there is a lymph node here. So this means that there is a cancer cell. So when it moves, it can move through the lymph node and go to the arm. That's why you see many people who have breast cancer. Sometimes the arm is very painful or is swollen. Why? Because the breast has moved the cancer through the lymph node to the arm. Yeah.
It calls for someone to be very careful and really care about themselves,
Yes.
about the
Yeah.
risk of breast cancer.
Yeah.
Let's talk about a little bit about the treatment before we come to prevention as we create awareness and wind up.
True. Breast cancer can be treated. Can be treated. In fact, I want to say 100% can be treated.
Why not other cancers then?
No, you know, I'm saying that strongly because we are talking about a cancer that is killing most women. In fact, there are two types of cancer that is killing women: breast and cervical cancer, period. So I don't want to talk about throat cancer in women and it's killing it's killing women, yes, but very few. But with breast cancer, it is killing women. If you hear a woman has died of cancer, there is a likelihood it is breast cancer or cervical cancer. And yet, breast cancer, compared to cervical cancer, can be prevented and can be treated if you get it in early stages. So, people should not fear. We have different methods of treatment. You can be given hormonal therapy, what we've talked about, because you've said these hormones are a risk. For example, a woman who has never given birth,
Yes.
the hormones, they have had this hormone called estrogen for a longer time. When you get pregnant, you develop progesterone. Then when you start breastfeeding, there is oxytocin hormone that now balances these other hormones. If you have never gone through that, you have stayed with a very one hormone forever, there is a risk for breast cancer. You realize? So that's how God balances our bodies, and that's how God created us. But when you realize that you have breast cancer, we just give you hormonal treatment. And this hormonal treatment will balance the hormones in the body and reduce the progress of breast cancer. Just simple. And people get healed. And there is also surgery. We can even remove the breast. We can remove the part of the breast that have been affected, leave you with your breast. God will heal it, and you continue with your life. We can get off the lump, do cytology and histology, see if it has cancer. If it has cancer, we'll come back to you, tell you, no, come back. We want to give you drugs to prevent, maybe chemotherapy, to prevent you from getting cancer. Because wherever we remove that lump, there are some small cells that might grow. Then when you give you chemotherapy, you are free from cancer. But when you delay, when you come to us when it's too late, we have to go through very serious treatments like radiotherapy and other methods.
And I like it. You always insist that they shouldn't come to you when it's too late.
Yeah, when it's too, and I've told you, you don't need to go and queue to a gynecologist clinic. I'm not saying gynecologists are bad, because they are my colleagues.
Yes.
But you know, for you to find a gynecologist is quite expensive.
Yes.
And sometimes you have to wait. And you know, people nowadays, with this economy, people are very in a hurry. They don't want to queue to queue for so long just to look at the breast that they feel it is normal. So they want to come here, be screened, go home. So if you want that to be done very fast, go to your nearest health center, the dispensary. That nurse there knows how to screen for the breast more than even the gynecologist.
Wow.
But if you have a chance to visit the gynecologist who is not busy, go pay the consultation, or if you have insurance, let the nurse who is there, or maybe the gynecologist himself, because they are the most people who are educated even to diagnose breast cancer than anyone else. So you can still go and confirm with him if you have breast cancer or not. I've told you, women who are above 50 years, we have mothers, we have sisters, we have relatives who are above 50 years. Have you ever told them that they need to go to the hospital for a test called a mammogram? There is a test we call a mammogram, which is screening women who can get cancer. And it will tell you that you are at risk of cancer. And the doctor will start the treatment immediately, and you get well. Yeah.
There are two questions about the mammogram and the screening.
Yes.
Can you do a mammogram around when you have received your COVID-19 vaccine? And can you also screen for breast cancer while you are having COVID-19?
While you are having?
COVID.
Vaccine or?
The virus.
You know, COVID-19 is like a virus. Viruses are very funny. They get in our body, then they go off very fast. The only virus that stays in our body forever is HIV. But the other viruses, they just come and go. They just come and go. And if you are not lucky, they take you away.
That's true.
Yeah, so if you ever suffered from COVID-19 and you got well, you no longer have COVID-19. Maybe what you are having is just the sequelae of COVID-19, maybe the complications that you had, like you had fibrosis and other things. But the virus is off, it's not there. Vaccines. If you get a vaccine for COVID-19 does not stay in your body or cause problems in your body. A vaccine just makes your body to be protected from COVID-19. Yeah. Right. So any woman who got COVID vaccine, any woman who got COVID, they can still go for breast cancer screening. It is nothing. It does not affect your life.
Even the mammogram does not affect.
It does not affect you. It cannot. So a mammogram is just an X-ray, by the way. So like the way you will get an accident on the road, you break your bone, and you tell the doctor that I had COVID-19, so don't take an X-ray. You will die. So mammogram is just an X-ray. No big difference.
All right.
Yeah.
Let's turn to the preventions, Daktari. How do we prevent? We've talked about these points, how we can prevent this breast cancer. But maybe if you can insist and put more emphasis on it.
I think in most of my discussions I've about prevention, and I'm talking about it passionately. If you are a man, let me not talk about women. If you are a man, there is a woman in your life. If you really want to stay with this woman for so long, continue bringing them to the hospital for screening. If you are a man, there's a woman who gave birth to you. Make sure that that breast that you suckled is screened, so that if your mother dies of breast cancer, it will really be painful to you. So take your mothers to hospital, take your wives to hospital for screening. And I've told you, if you feel like that hospital is so busy, go to the nearest hospital. But they even private hospitals, some private hospitals are very good. They have very nice nurses. These nurses are trained well. So as long as they are registered nurses, they'll tell you if you have a risk for breast cancer or not. And not just breast cancer, but even cervical cancer. So prevention is key when you are managing breast cancer. And that's why even the month of October, we really encourage women to come for screening, because it's a breast cancer awareness month.
Yes.
So women just come to hospital for free screening. And I've told you, forget about the mammogram, because I know people will start saying, oh, the mammogram is expensive. There is clinical breast examination that a nurse will do on you free of charge. It is in any hospital, even the public hospital, even the private hospital, it is free. Then there is self breast examination, which you do for yourself at home. You do it every week.
Maybe for the self-examination,
Yeah.
can you just do this, the illustration for the self-examination in a quick way?
Yeah, so I think for the self-breast examination, the first thing that you do, you have to undress. No, there are people who are doing self-breast examination and they have clothes on. No, you have to undress at least to the level of your umbilicus, or maybe here. Then your breasts are exposed, so you can do it either when you are standing or when you are sitting on a couch, or when you are sitting in front of your mirror.
But you must be upright.
You must be upright. So you look at the shape and size of the breast, you look at the color, you look at the nipples, how they look like, because everybody has their types of nipples.
Yes.
So you have to look at how they look like. Then, now, that is just cross-examination on the mirror. You try to lift up your hands like this to see if they are moving. Breasts must move as you lift up your hands. If one breast sticks and another one is moving, there's a likelihood this breast has cancer. So you try to move your arms. And when they move, they have to move at the same rate or level.
Yes.
Then secondly, you start now palpating. It's very simple. You start pressing on your breast. If it is your right breast, you use your left hand. You press, and when you are pressing, don't poke. When you poke like this with the tip of your fingers, you don't feel anything. You have to use these pads, the pads of your fingers. You just press as you move. This is anti-clockwise. Yeah, you move anti-clockwise as you feel. Then once you have done that, you come even all the way to the armpit to see if there is any growth. I've told you that there are lymph nodes that are available in the armpit that can be cancerous. Then after that, you squeeze your nipple. If you squeeze your nipple and there is any discharge coming out, you are not breastfeeding, there's a problem. If you feel any lump, you go back. If you feel anything that is not normal, your breast has to be very soft. If you feel anything that is not normal, then there's a likelihood that there is a problem. Then once you are done with this breast, you come to your other breast, you use the other hand, you make sure that you palpate the same way. You go clockwise.
Yes.
Yeah, maybe anti-clockwise. So you make sure that you squeeze, and don't press. You are just trying to feel it.
Yes.
You are not pressing it. You are just trying to feel it. Then you squeeze the nipple to see if there is pain or if there is any discharge coming out. Yeah. So that's the very easy way of checking the breast.
I wanted them to get that so that they can also do their self-examination while at home before visiting the hospitals.
Yeah.
Now, Daktari, the last question as we create just awareness and wrap up our show this time. why the month of October, and what can they do, our audience, what do they do at this month of October in terms of breast cancer?
In the month of October, we dedicated it to be a breast cancer awareness month.
Yes.
And we always want people to come to us for any questions, any screening, any kind. If you have not done a mammogram, this is the month for you to do it. If you have not done a self-breast examination, this is the time for you to do it. If you have not done an ultrasound, this is the time for you to do it. So people need to visit the hospitals for just to create more awareness. Then also, when you have this information, kindly pass it to another woman. If you see any woman who has a breast, just pass this information to them in the month of October. Because soon you will be called in a harambe that your friend has breast cancer. They are going for chemotherapy. It is you who will feel the burden.
Yes.
So instead of waiting for that moment, just tell your friends to come for breast cancer screening. It is free in most occasions. If they will need any ultrasounds or mammograms, that's when they will pay something small. But it's worth paying for than going for the chemo sessions, because the chemo sessions are very expensive. So let's support each other as women, especially women, but even men, we have breasts.
Yes.
So let's come for screening anytime we see any problem.
Yes.
But I've not seen men going through mammograms and ultrasounds, but sometimes we do. Especially if a man has any problem, we will do the mammograms and the breast ultrasounds. Yeah.
All right. Now we've reached the end of health, hygiene, and wellness this time, speaking about breast cancer, and I hope you've informed yourself, you have found insight in what we've discussed at this time. Daktari, do you have anything, or we can wrap up?
Just to say, we really love all our women. We don't want women to die of breast cancer. Come to the hospital. Let's be ready to prevent breast cancer. So let's not stop joking. Let's stop joking with life. Let's be ready to prevent breast cancer at all costs, and we are ready to serve you.
All right.
Yeah.
Thank you so much, Daktari. It's the end of Health, Hygiene, and Wellness. My name is BARASA SAENYI. Keep watching IMANI television. Until next time, thank you so much, and bye-bye.